in this session today. It's the COVID-19 triple challenges of poverty, inequalities, and unemployment in South Africa webinar with a special or zoom-in focus on socioeconomic challenges and responses. To introduce myself, my name is Azola Dayile. I am a program manager at Media Monitoring Africa, but also a media trainer with the Mobilizing Media Fighting COVID-19 program with JHR. So we're bringing you this webinar in collaboration with JHR, Media Monitoring Africa, as well as Sound Africa. So as I've outlined, we'll be speaking on the socioeconomic challenges and responses to COVID-19, the triple challenges of inequality, poverty, and unemployment, and how also these affect human rights. So to speak on these issues, we have two very well-learned speakers on this issue. The first one being Prof. Nicholas Ngepah. So I'll just give you a brief introduction of the Prof. Prof. Ngepah is a professor of economics at the University of Johannesburg. He's an expert in quantitative techniques, economic development, and policy impact assessments. He has a wide range of experience in developmental issues, and his core expertise are in poverty, inequality, and inclusive economic growth. And then our second speaker is the lovely Isobel Frye, who is a director at the Studies in Poverty and Inequality Institute based in Johannesburg. By profession, she is a commercial law expert and has plied her trade as a senior researcher in poverty eradication at Naledi, went on to become the National Advocacy Manager at Black Sash, and also practiced as a lawyer in commercial litigation with Walker attorneys. So those will be the people who will be speaking on the topic of the day. And without wasting any more time, I will give it over to our first speaker, which is Prof. Nick Ngepah. Prof, if you can take it away, please.
Thank you very much. And if you don't mind, I want to set the context in terms of talking about the kind of inequality we're experiencing in South Africa. And from there, I will talk about how that inequality poses an important challenge, and the challenge of being able to effectively respond to COVID-19. And primarily, it's the problem of poverty, but it's compounded by high levels of inequality. And if you would not mind, I would share a few graphs just for the background, and then I will speak to other things, background to trends, inequality trends. So thank you for giving me that room to share. Let me share. So sorry, I just put my full screen. I hope it's visible.
Indeed, it is visible, Prof. Thank you.
Yeah. The first thing about poverty is that we know that the period immediately after apartheid, from around 2000 to 2007, 2008, South Africa recorded robust economic growth. But that growth had not been pro-poor because poverty had remained very high. And as of 2017 data, and that is a national income dynamic study that I have worked on and worked with, and Statistics South Africa's own calculations as well. Poverty in South Africa is above 50%. Some figures place it at 55% of the population below poverty. At the same time, we have high levels of wealth in South Africa, the levels of development that is European standard. So that kind of level of poverty that has been persistent, growth that has not resulted to poverty reduction significantly commensurate to what one will have predicted when we look at the experience of East Asian countries. The reason is because of high inequality, particularly in South Africa. So that is the background about poverty, the context of very high levels of poverty. Now let us look at the kind of inequality we're dealing with. It is important that when we talk about inequality, we usually point the finger to apartheid and we point the finger to racial inequality. But I think that we have to speak a lot about the fact that the structure of the inequality we're dealing with has been changing. For example, this graph you are seeing here is a decomposition of inequality, is based on a work I did in 2013, but also the second part of the graph is what I just did this morning to extend it to present day, which is around 2017. So if you look at the graph, you will see that average inequality is always high. And so we would, if we buy the idea that we inherited this from apartheid, then we will go with that. But when we break it down into interracial inequality, inequality between race and within race is actually primarily within Blacks versus within whites or within other groups. When we break it down, you realize that the between inequality has remained high from 1992 to about 2001. But it was falling, and it crosses from 2001 is within group. The Black population contributes more to inequality to the point that it overtakes the between group. And you will see that by 2006, 2007, it was very high. And that was the period we're entering into the financial crisis, where we saw the collapse of growth. And from that time, South Africa has struggled to recover from the low growth that it experienced. Then COVID-19 came and compounded everything over that period. Then when we move to 2010 to 2017, based on the national income dynamics data, the previous graph is based on the ARMS data. This, the media data set that is out there. The second is the national income dynamics data. You see that the trend continues. Average inequality remains high, is usually around 0.63 if we're dealing with Gini, or 0.8 something if we're dealing with tail inequality. But you see the green line is the continuation of the widening gap between inequality within, which is primarily Black contributed, and inequality between. So what do we see here? The inequality that we are talking about, the structure has changed significantly over time. It's not the same inequality anymore we are talking about, although the average number remains the same. What happened immediately after apartheid is that gradually through BE deals and investment in the human capital of some Black citizens, some African citizens, they have climbed the ladder of social mobility, and but left so many behind. And that is why inequality within African population is rising compared to inequality between Africans and the whites. What is the implication of this? You would notice that increasingly, the volatility and the violence that we experience is not necessarily Black and white. It is within race, within Black violence. Occasionally, we will find racial undertone erupting, but the killings that we find happening is usually within race. It's not so much between race, except for some farm murders that we experience in the agricultural sector. So if you look at inequality by racial groups within contribution of inequality by racial groups, the very dark lines are the African population and the colored population. They have remained high from 2008, but actually increasing. If you look at 2017, the numbers are quite high. So they are high and increasing compared to the white population, which is the lighter population, which has decreased from 0.46 to 0.41 in 2017. I haven't included data for 2019, 2020, but we can approximate that using the labor force surveys that have been published. Now, the income shares, we also see that the income share of the Black population, which is the topmost dark line, has increased up to 2014 and decreased slightly, but remains high compared to the rest of the population. Now we're dealing with survey data. In survey data, you don't capture the extreme incomes. But in any case, those extreme incomes, I don't really think that that is what is contributing to volatility in the socioeconomic volatility in South Africa. I think that what is contributing is the kind of inequality that we can capture in survey data. Because if you look at what was, first of all, termed xenophobic tendencies, and then later different kinds of violence that erupts here and there from time to time, looting of shops and all of that, is usually closer to the poorer neighborhoods. It's not usually very far away. That means that the population, they are moved by what they see. They are able to see the differences in standards of living. You would think about adjacent suburbs versus other suburbs that they are able to see and take action. But the extremely wealthy ones, they are not even within the population. They are usually secluded. So we should be very careful about the kind of inequality that it would lead to the spark that will tend to become sociopolitical unrest. So that is the background. Now, I didn't prepare slides for the implication of this poverty and inequality background on the COVID-19, but it's going to be based on the paper that I have done, one of which is published in African Development Review, then the other that deals with mortality and is global. The African Development Review paper is it's on the spread of the disease and the lessons that Africa can learn. It's limited to African database, but the one that is published in Health Policy and Planning in the UK is global. It's dealing with mortality, but I'm looking at similar socioeconomic backgrounds and their contribution to the spread of the disease and to deaths due to the disease. One of the variables that are included in the model is government lockdowns, government stringency measures, which is primarily the lockdown. And I have found that the lockdown was not significant in preventing deaths. It wasn't significant in preventing spread. On the contrary, the kind of measures that were very significant were measures like hygiene, measures like early management of the borders, and measures like the inherent characteristics of the population in terms of poverty, in terms of the endowments, the capacity of the population to be resilient to shocks and all of that. These were the factors that really matter. Why is it that government actions like lockdowns don't work? 2 weeks ago, the World Bank released a working paper by Ma and his colleagues. And the working paper compared African developing countries, low-income countries with high-income countries in terms of the effects that the economic slowdown or the economic collapse of the lockdown has on the population, other aspects of the population like health and the ability to bounce back. Over time, they have discovered that over time, in the long run, from now to a foreseeable future, relatively poorer citizens of the population will still be paying for the consequences of the lockdown in terms of infant mortality, the malnutrition that will have kicked in, the high food prices that they will be facing. So there are a number of factors that the poorer population will be facing going forward that will lead to even bigger mortality, far higher levels of mortality than the lives that will have been saved through the lockdown themselves. But the fact that a number of research, including this one, shows that the lockdown has not been effective in saving lives and even curbing the spread of the disease. Other factors that were within the population are the ones that were more effective, like sanitation and others. The question then becomes, what should we do? How should we go about dealing with a pandemic like this in the future, in the context of high levels of poverty in South Africa, but also in the African continent, in most African countries, but high inequality, which is peculiar for South Africa being one of the countries with the highest inequality in the world. When you find this kind of situation, then if your first reaction is lockdown, you won't succeed. Why? Because lockdown is meant to limit movement, because the spread of the disease is through movement. The question is, why do people move? People move primarily for two key reasons. There are other smaller reasons why people move, but primarily for two key reasons. Number one, and the most important reason, is livelihoods. People have to make ends meet, and therefore they are always mobile. Even migration, majority of the migration we see, whether it's within country migration or international migration, is usually for economic reasons. Even when people are fleeing conditions in their home country, refugees, at the back of it also, primarily there's economic issues that they are hoping to get better outcome of livelihoods in other countries. That is the reason why they move. The second reason why people move is for leisure. The second most important reason why people move is for leisure. Now, leisure is for relatively well-to-do part of the population, not the poorer people. Now, when you have lockdown, the first people to immediately feel the impact of the lockdown would be the poorer people whose means of livelihood is through mobility. For example, poor people cannot have their livelihoods exercised on the internet. They cannot work at home. A domestic worker, for example, cannot work at home. A casual laborer cannot work at home. A farm worker cannot work at home. He has to move. Whereas you and I, who do white-collar jobs, we can easily work at home. So while there is lockdown, our work is going on and our salaries are passing. And this is the most important issue that we should take into account. These are analyses that were not properly looked into in the beginning. So what should happen? There are first important things that need to be done. The first is, what do countries do? What should South Africa do when things are normal? To invest in proper infrastructure and spatial planning in a proper way, and to ensure that the poor have been empowered to be able to have their livelihoods close to them, where they work or where they stay. People would leave one province and travel across another province. Primarily, you will see that relatively poorer people will travel longer distances in order to work, and then they travel back. Domestic workers generally are like that. So if that is the case, then what should happen in the beginning is that you don't jump into lockdown. You manage the early signs of the disease first. What is that? We saw that international border management was an important factor. The amount of the spread of the disease in the beginning determined whether the country will be able to cope subsequently. Countries like Mauritius, for example, acted very early, and they have a good breathing space to be able to take action subsequently, because early on they managed the borders well. In South Africa, borders were not managed that well. At some point, it's private airlines that began to shut down flights. Government stepped in only way later with the lockdown on the 26th of March. But before the first case enters a country, government is supposed to look forward and preempt that. Most importantly, is the infrastructure, spatial planning, as I've talked about. And this is not something that you do when a disease is at your doorsteps. It's something that needs to be done on a day-to-day basis. And unfortunately, a number of issues have emerged over time in African countries, and particularly also in South Africa, that the citizens tend to lose faith in the government in place for two reasons. Number one, the effectiveness of the government, and the legitimacy in terms of corruption has been high. And at the end, citizens will think that the lockdown is, or the poverty and the lockdown and the stringent conditions that ensue is a consequence of what the government workers have been doing, people in power have been doing. So before I go ahead, I just want to find out whether I should give a chance to other people, because there might be questions. Let me not just keep talking. Can I ask that question?
All right, thank you very much, Prof. That was quite informative and very much in depth. I know that many of the people in the session have, are dying to ask questions. I know myself, I also am dying to ask a question or two, but I will ask that we note those down and we park them for now, and we give Isobel Frye an opportunity to also present, and then we can have a question and answer or conversation session at the end.
Thank you.
Thank you very much, Isobel.
Thanks very much. I am hoping to be sharing my screen.
Yep, we can see it.
Can you?
Yes, thank you.
Okay. There we go. So I'm actually not seeing what others are seeing on Zoom, so I am just going to continue.
Okay.
There we go. Right, so in terms of the invitation to talk to COVID-19, the triple challenge of poverty, inequality, and unemployment in South Africa and big, I just want to firstly thank you for the invitation. It is something which I've been spending the last number of months really at the coalface of at NEDLAC and the work that we do there. So I'm going to try and contain the presentation so that there is time for discussion afterwards. And I will talk to the trauma, as I call it, of the incomplete transition in terms of the poverty and inequality as exacerbated by COVID-19. And I'll start off by giving a snapshot of the socioeconomic reality. I'll look to the Constitution for guidance as to what the state should be doing to intervene. And I'll come up with a recommendation in terms of the completion of the Liberation Project, which is a basic income grant to everybody, and then conclude. So if we look to, this is a very, very small slide, and I don't know whether any of us would be able to see that, myself included. These slides will be made available to everybody. So the Prof was talking to, with his grants, with particularly to inequality, but here looking at just the issues of poverty, we know that pre-COVID-19, 1 in 2 people in South Africa lived in poverty, and 1 in 4 lived below the food poverty line, which is now about 585 Rand. So we're looking at a situation in which, if you just look at the general statistics, we are not in any way a nation in which people are able to live a decent life in any due regard. And of course, the inequality is the kind of skewed distribution of that. Just an update on that using the NIDS CRAM data, which was published 3 weeks ago now. In the last wave, we know that 13 million people in South Africa are living in hunger, 3 million of those being children. And at that stage, the Social Relief of Distress 350 Rand grant was being paid to 7 million people. So despite that state intervention, that was still the face of poverty in South Africa. Looking at the first quarter labor force survey in South Africa, we know that 43% of people in South Africa are broadly defined as unemployed, which includes people who've given up looking for a job, the so-called discouraged work seekers. I think from a statistical perspective, the very alarming figure there is that 77% of 15 to 24-year-olds are unemployed, so they're not in a job. And in addition to that, long-term unemployment is sitting at 70%. So that's a global figure, which indicates the decline in people's likelihood of getting back into a job. So of the unemployed, 70% are sitting in long-term unemployment. And so formal employment in South Africa, we're looking at 10.5 million people. 2.5 million of the formally employed are actually in informal employment. So formal employment doesn't denote decent work. 2.5 million of the 10.5 million formally employed are basically in some kind of informal employment. So 7.2 million people formally unemployed, but we do need to take into account the 17.2 million working age people who are defined as not in employment, education, or training. So our categories are things that we need to interrogate quite closely. So if we're talking of just like white formal unemployed, we also have this even larger crowd of people who surplus to this whole engagement of unemployment. Moving on to inequality, which is the third bold point there. We know that in inequality in South Africa, we're a global outlier, and the Prof was talking about between race categorization of inequality. I think it's also important that we note that inequality should be considered both in terms of income inequality and wealth inequality. So income inequality at 0.63 there, wealth inequality, which people like Thomas Piketty and others have drawn attention to as being intergenerational indicators or markers of well-being, 0.9 in terms of wealth inequality. And then we know a lot of people say that we can redistribute if we grow, but we know that our GDP has been growing for the 5 years pre-COVID 2019. We've had a shrinking GDP, and National Treasury is forecasting the next 3 years of negative growth, which is a nice way of saying shrinking going forward. So the outlook is not great at all. That was pre-COVID to a large extent, although bringing in the unemployment. We have structural constraints to how we are dealing with poverty and inequality. And we need to make sure that our solutions as we form them are able to take cognizance of that. So I just this morning was looking at the NIDS Cram Wave 5 data again. Again, if we start looking forward, we've got worrying indicators that an increase in children dropping out of school in the first quarter of this year, another 750,000 children dropped out, which meant they're not going to complete school. They're not going to gain the kind of skills that we are needing in terms of a new labor market replacement. So the other aspect, which I think is remarkably worrying, is that of the children in fee-free schools, their learning compared to the same period pre-COVID was down by between 70% and 100%. So those children who were trying to get to complete their schooling are not getting the kind of education that we're requiring. I've mentioned the people in hunger. The findings are that women are shielding hunger from children. And the last bullet point there is that it leads to a massive increase in mental ill health. So the impact is not just what you see around you, but it's also in terms of mental health. And then the second last bullet point there, what I found interesting was the churning in employment. So for people who are on the margins of employment, the prevailing way that they get reincorporated is short piecemeal work. And one thing that we've been engaging on with National Treasury is that the addition of the condition of unemployment to social relief of distress grant eligibility is a very big mistake, because it discourages people from trying to find piecemeal jobs because it will disqualify them from the certainty of the 350,000. I'm not going to spend time on this slide on inequality because of the Prof's focus on that. We just know that wealth and income inequality is always linked to political inequality and the value of one's voice in terms of determining the choice of policies to address the levels of poverty and inequality is determined by the class that you're in and the class interests. So now just very briefly looking to the Constitution, we know that the preamble of the Constitution says that we need to heal the divisions of the past and establish a society based on democratic values, social justice, and fundamental rights. But we know that it's meant to lay the foundations for a democratic and open society, to improve the quality of life of all citizens, and to build a united and democratic South Africa. Now, we didn't see much of that in recent weeks in South Africa. We did hear, however, reference to the fact that people needed to respect the rule of law. And in my analysis, the respect of the rule of law states with the fact that the state must respect, protect, promote, and fulfill the rights in the Bill of Rights. And those include the fundamental rights to equality, to inherent dignity and life. We know that the Bill of Rights contains the guarantee to people of the right to sufficient food and water and to social security. And if we are advising that people need to subscribe to the rule of law, we need to be the ones that are providing that. We need to make sure that the state is providing that to people. And so just picking up then on the question of the rule of law as applies to the majority of those people who, in the beginning of the presentation, I showed the millions of people who are living in poverty, the millions of people who are not accessing jobs. We believe that this needs to be turned around, and from our analysis and being working within social policy for the last 15 years as an institute, we just want to share our view on that, which is that social support started strong in the lockdown with the 2020 relief packages, but that ended in October for caregivers, and then in April 2021, the social relief of distress grant was withdrawn. There was no indication given to people when that was going to be included or reintroduced, and that was cited as a key cause for recent violence. So when we look at the new promised rollout of social relief of distress, with today being the day for registration until March 2022, too many twos there. Our quick analysis, what we want to share quickly, it's not quick analysis, is firstly that 350 Rand is not enough money. If you look at the modeling of the type of intervention that we need because of the structural marginalization of our economy, we need to have enough that doesn't only address people's immediate humanitarian needs, which is what the 350 might go to some way to doing, but gives enough to actually stimulate further demand. So we need to ensure that people have enough money to start supporting each other's micro enterprises, whether that's in township economy or in depressed rural towns. There needs to be enough money to disrupt what has been happening, which is that shrinking economy, and to shock us onto a higher growth trajectory. So we say, firstly, not enough money and not to enough people. If you look at the qualifiers that National Treasury put to the President's first announcement, as I said, the inclusion of unemployment as being a prerequisite means that you are holding people dependent. It's going to be a consumptive and not a developmental grant. And hence, the calls for a universal basic monthly income grant of 1,268 Rand per person per month, which is foundational to a humanitarian rebuild, but also a societal rebuild. And we believe that it is affordable through blended financing sourcing, which we've repeatedly shared with National Treasury, that includes the total cost. And I'm first going to go through the cost and then just reference the lending patterns. So the costing there, the total cost of a universal basic income grant at 1,268 Rand per person per month, which is the current upper bound poverty line, less the discount for clawback and things that you take from people in the multiplier, would be 207 billion Rand per person for the year. Now, where does that come from? Many people are of the view that we can't possibly afford that. On the one hand, our constitution says that we must afford it. So the question is, how do we come across that? We've identified 11 ways with one of our research associates, Dima Krokule, looking at monetary financing, central bank lending, quantitative easing, looking at the excess excess foreign exchange reserves, UIF surpluses, restructuring what we call SA Inc. Balance sheet, including reduction of PIC funding, the lending itself by PIC, which would be a possibility, GPF borrowing, payment holiday, increased borrowing. We know that if we borrow from the central bank, the Reserve Bank, that's at less than formal bank lending rates. And looking at higher taxes, wealth and financial transactions tax. We don't want to tax income when we're in a recession, but we certainly have idle wealth, which should be taxed and brought into the kind of circulation that we need. We know that the commodity boom has left us with billions of unexpected money coming in. If we use that to kickstart the basic income grant, the multipliers over time, sort of short-term time, 18 months to 2 years, will start paying for itself. We need to have a shock to the system that enables us to grow our economy. So the benefits of a decent basic income grant of 1,268 Rand per person per month would be to firstly meet people's basic needs. And that's what, as a country, as a nation, as a society, should be our driving aim. We need to eliminate the poverty and reduce the stunting of people and the mental health illness. And a decent big of 1,268 Rand per person per month will do that. Hungry children can't learn. In addition to the fact that the current devastation to people and to communities, malnourishment causes a rack of diseases in later life, which is a further cost to the state. We believe that building successful micro policies around a decent cash injection will multiply benefits. And as a social policy institute, we're talking to class at UWC around the kinds of food processes, the food planting, both in urban and rural areas, that we could model based on this massive cash injection. We're also looking at financial inclusion. There are possibilities in terms of which a basic income grant could be paid through e-wallets and smartphones, which could link government to every person in South Africa and also develop our tech sector. So we're looking at solutions to the current crisis, which have multiplier and forward-looking ways of taking us out of the morass, but also taking us onto a higher growth path. So in conclusion, and I put this in because I know that many of the people in this are linked to the media. So my challenge really is, how are people depicted by the media? And this is critical, as active agents or as passive victims, as marauding mobs or as active demonstrators. And I think as the framers often, the media have a crucial way to understand what is being reported on. So the mediating of the conversations is critical, with a variety of voices to be heard, because we all, 60 million people in South Africa, there are many different ways of looking at the same pictures. And I think those narratives need to be crowded in so that we gain a better understanding of where people are, and so that we don't have to resort to violence in order to ensure that our voices are heard. Pursuing the real story is difficult, but as I said, there can catalyze a deeper analysis, and better analysis leads to better solutions. Challenging clear thinking and respectful engagement with each other's ideas. We won't always agree, but if we can find ways of respectful engagement, my understanding will improve, my thinking will improve, and hopefully yours as well. And so finally, because that's your job, to make thinking fun and to make thinking cool is a challenge that your sector has. So thank you very much. That is, I'm going to stop sharing so that I can see everybody else.
All right, thank you very much, Isobel. That was very, very brilliant and quite informative. You know, and then you wonder if there are these sort of like ideas and recommendations outside of the government, you know, what is happening inside. But I think I'll open up the conversation session, but I'll take the privilege as of facilitator and open up the floor myself. I wanted to begin on the part, on the closing part, on your closing part, where you mentioned the fact that, you know, most of the people who are part of the session are media practitioners or involved with the media in one way or the other. So I wanted to ask then, you know, okay, damn, I forgot my question. Sorry, guys. I'll just open up. If anyone has a question, I'll just find my question and opening it up. I just got a bit distracted right now.
Azola, can I ask a question while people are coming and bringing their questions together, which is that possibly people in your audience who are active in as media activists, how the challenges exist in terms of reporting poverty and inequality and challenges like that, or possibly just for practitioners to share some either challenges or really good ways that they've found that they can link to the questions before us of the day, because it must be difficult to always come with a new angle. So as a research organization into poverty and inequality, are there things that we can be feeding you, and how would you like those accessible?
No, definitely. And I hope the participants heard the question and they're thinking about it. So I found my question, sorry about that. So there's this misconception, Isobel, I'll begin with you. There's this misconception sometimes, which is also exacerbated by the media professions themselves, where they say that, they ask the question, will the basic income grant be a forever thing? Because there are these ideas or misconceptions that it promotes a level of laziness, and it will also in turn increase the number of people who are no longer actively seeking employment. So there are these ideas doing the rounds. Sometimes they are rehashed by media practitioners, sometimes they are said by political analysts when speaking on these issues. So there's this misconception that this basic income grant of 1.2 will just make all of us lazy and not wanting to go out for jobs, and that the government cannot fund this because already it cannot fund SCOs. So where is the money going to come from? That's my question. I'll begin it like that.
Thank you. It's an excellent question, because it is a knee-jerk reaction that people have, and they've had it over time. I mean, at the heart of it is an ideological horror of giving money to people without demanding that they work for it. And somehow there's a inability to see that people would be able to use it in terms of a beneficial aspect. But just three very short responses to that. Firstly, because a universal basic income grant is universal, you don't get punished for working. I indicated our concern about social relief of distress, where employment renders you ineligible. We need to be crowding in jobs and people to the job market. So firstly, you don't get punished by having it taken away. Secondly, there is piles of research over years and decades from different social grant transfer programs globally that show how people are actually better able to look for jobs if they have access to a reliable, regular income amount. I mean, if you've got 10 Rand in your pocket, do you take a taxi to look for a job, or do you use it to buy bread because you don't know where the next money is coming from? If, however, you're able to plan ahead and you know that there is next month grant money coming in, you can take greater chances. Also, the thing is that we have supply side interventions. Often the state tries to put in, for instance, wage incentives. But if you're trying to stimulate the informal economy, which is our growth engine right now for jobs, and you're doing so in operations where people have absolutely no disposable income, there's no way that they can that people can support each other. So you can't, the woman who's selling tomatoes at the end of the road will not sell them unless there's somebody who has money to buy them. Likewise, the kids who want to start up sort of an IT company in township areas, unless people have that small amount to be able to pay them for the services, it's not going to happen. So instead of seeing the fact that everyone's going to sit down and be lazy on 1,268 Rand per person per month, which is not enough to get you lazy on, we need to be looking at the kinds of messaging that say, you're going to have money in your pocket, what are you going to do with it? And those are that's the dynamic that we need to be looking at, because the research shows, and we as an institute, we deal in research and data. All the evidence shows that people become more productive if they have access to grants such as a basic income grant.
Right. Thank you, Isobel. I guess also that becomes the role of the journalist to dig deeper and come with these things that you're saying. So Gracious Mkabela, sorry, has a question. So if anyone has a question, they could either lift their hand up or just write it on the message box, and I'm sure that new people do have questions, so please do share those questions. So the question also still goes to you, Isobel. So it says that the withdrawal of the 350 social grant caused a recent violence. Please explain the finding. I'm assuming this was in the presentation that you had. How did you find, or how did you come to this conclusion that the recent violence that we saw was a reaction to the withdrawal of the SRD?
Absolutely. And my answer to that is that I didn't say that it was the sole cause. I think there were a number of facets that linked to it, but it was actually in qualitative interviews with people who were interviewed who were caught in the looting, and journalists on the people on the spot, journalists who interviewed people asked for people to reflect on the causality, why they were. And for many of them, the first thing that came to mind was the fact that they didn't have access to the 350 rand, and that the 350 rand wasn't renewed when the lockdown was renewed. So for many of the people who randomly, I mean, if you want to take the sampling was completely random. It was the person to whom a journalist on the media spoke. They raised that as being a contributory factor to why people were prepared to risk being arrested, to risk being imprisoned as a result of their activities, was because they had no hope because the grant was taken. Zalo, there we go.
Sorry. All right, thank you very much, Isobel. Any questions, guys? To Prof as well? Otherwise, I'll just keep asking the questions myself, which won't be fair. It's an excellent opportunity for you guys to ask questions and work on your stories. But to keep the session going, I do have a question for you, Prof, if you're still there. So according to stats, in 2017, almost 20% of South African households had inadequate or severe inadequate access to food. This was 20% of SA household incomes had inadequate or severe inadequate access to food. And recently, you know, with the COVID-19 and the lockdown, and with the rise of fuel prices, which also affect the rise of bread prices, you know, and also the rise of unemployment, how then do you imagine the figures and the situation to be today in 2019? Because these were figures that were in 2017, where it was only 20% of the households who had a severe, you know, inadequate access to food. But now I can imagine that it has grown so tremendously, but I would like to hear from you about that.
Yeah, I haven't had a figure at my fingertip concerning those who would be who would not have access to food, but I think that Isobel made mention of certain figures as well. She touched on that using the recent Needs Cram survey. However, it is important that we note that South Africa has excess food in the midst of people lacking food. There's food wastage, and there is lack of food. Now, prices of food had been increasing during the period of the lockdown for a number of reasons. Some were anti-competitive behaviors, but others were genuine reasons because of a lack of those food commodities because of the lockdown and the effects of it. That comes to the buying power of the poor people. While you address the supply side of the food itself, you have to address the demand side of the food, which is where Isobel, her presentation about the social grant makes sense. I had seen in other media outlets that we have the upper poverty line of 1,268 rands, and you give the poor person 350 rands. What can 350 rand buy when you get into a shopping complex to shop for basic necessities? So the figures would indeed be far higher now than before. That is without doubt. And I don't know whether Isobel has anything to add to it, because she has figures in her presentation.
Isobel, if you have anything to add, please, may you do.
Thank you. All these muting is very complicated, sorry. So I think that, Prof, thank you. That's a really good contribution. I mean, the food poverty line of 585 rand is enough to buy the goods that the World Health Organization has deemed enough for people to survive on. So it is an incredibly low amount in terms of of what you're able to obtain through that. We know that the social relief or distress grant is only 60% of that. So basically you start off with a 40% deficit on what you're able to obtain in terms of food. Now, if we're trying to see the stimulus, the kind of shock stimulus to economic growth, we know that people need to have access to more than that. So the upper bound, the 1268, includes those basic foodstuffs of 585 Rand. And then it includes what, through the lower bound poverty line, people bought instead of enough food. So basically, if you want to put it crudely, the upper bound poverty line together with the lower bound poverty line increase those amounts that people were willing to starve themselves. I'm sorry, the costs of those goods and services that people were willing to starve themselves in order to get. So in its of itself, 1268 is basically, it should be seen as the bottom line, the floor towards a decent standard of living. And in fact, one of SPII's long-standing research projects, which I'm sure the Prof would be interested in knowing about, is known as the Decent Standard of Living, with 2 other research institutes. We've asked ordinary people across the length and breadth of South Africa, what do you think defines a decent standard of living? Not a rich standard of living, not a survivalist, but a decent standard of living. And that's been calculated to the amount of about 7,600 Rand. So those people who have a decent standard of living have an aggregate income of 7,600 Rand. So I think we need to also, as we start looking forward in terms of solutions, take our aspirations below just surviving, and that aspiration needs to be a decent standard of living for everybody, because we are, as the Prof said, we're an upper middle income country. We have the Santons, but we also have the very poor areas, and it's how that collectively we look at the redistribution. And I think just to, because I've got the mic, so to speak, what was interesting is the HSRC, the Human Science Research Council, has an annual South African social attitude survey. So ordinary people are asked their attitudes towards things. And about over 60% of South Africans said the level of inequality it's not okay. Something has to be done. We know, each of us in our hearts, that what's happening is a ticking time bomb. When we see the repeated cycles of violence, when we acknowledge the high levels of gendered violence that exist in so many households, we know that something has to be done of a scale that disrupts our standard of living. And if ordinary middle-class people, if someone like me knows that my lifestyle will change, then so be it, because the majority of people don't have the ability to act as agents of their lives and destiny.
Yeah, I think what you just highlighted is very important, Isobel. So I'm noting Kabela's comment on the comment section. He says that the second positive effect of the SRD is that an Ukozi listener attested to the use of it for starting her own business, which is the business of selling chickens. I also note Siyabulela Mandela's question, but I would also like of him to unmute himself and perhaps pose the question to our panelists himself. It's a bit long for me to read. If you don't mind, Madiba, please. Okay. But also I do have a question to both panelists myself. This is my last question, I promise. But I would love to know the correlation between poverty, inequality, and patterns of land ownership in South Africa. You know, with the recent talks, or not even recent, there's been long talks of land expropriation, but it was with compensation previously, but now it's without compensation. And I'm wondering, you know, what is the correlation between then poverty, inequality, and land ownership in South Africa, particularly because these, we know that they are skewed along racial and gendered lines. Okay, and then, okay, I'll also give it to JD in South Africa to ask a question, and then the panelists can sum them up together. JD, you can go ahead and ask your question.
Yeah, thank you so much, Azola. Professors, I would think I have like I want to be a bit of a devil's advocate. Right now, we are facing a situation where we need to vaccinate as many people as possible. Do you think that, you know, forcing people to vaccinate as a positive sort of discrimination could help sort of ease up the lockdown and also allow people to go back to the labor market and work, or would that raise up other issues such as, medical or biomedical or people's rights? How do you see this playing out if lockdowns are not, the solution as you have demonstrated, and if the government is sort of reluctant to increase the grant to this, the level that is adequate?
All right, and then Mandela's question, which I would take as the last question. Madiba, are you still there?
Yes, sir, I'm still here.
Okay, if you can pose your question, Ngokele, please.
Thank you, leader. Prof, my question, I wanted to understand if there is any relationship between the universal income grants and a tendency towards a dependency of the citizens' dependency on the government itself, and also the relationship between them being able to impartially elect the government of the day vis-a-vis electing the government on the basis of the fact that they are basically under the dependence of the government. For instance, I'll give a typical example. We understand, of course, that in terms of the geography of South Africa, much of our citizens, particularly those that vote for the government of the day in this situation, the African National Congress, are largely in the rural environment. And there's been an argument that the government of the ANC is currently using such schemes as social grants to further mobilize votes for them. And there's also a tendency or a degree of inability of those particular citizens to critically hold the government to account, because for them, so long as they receive their social grants, they are ready to vote despite all the mass corruptions and maladministration that the current government is characterized on or is known for in the country. So I wanted to understand whether there is a relationship between or there is a correlation between the use of these basic income grants to further expand and increase the dependency of the citizens to the government, and further erosion of their critical thinking and abilities to hold their government to account. I'll keep it there, just not to make it long, Prof. Thanks a lot.
All right, thanks, Madiba. And I noticed that we are 5 minutes over time. If you guys could just lend us 10 more minutes of your time, but also to our panelists, Prof and Isobel, I'll take this as you've got the 3 questions, and then it will also be your closing for the session so that we can release the people. Thank you. Any one of you can begin.
I'll start because most of them were directed at the Prof, so he'll have the ability to address those more fully. I think the issue around access to land that you asked is key, and maybe we can have a follow-up session on that, because land is a prime source and asset for the majority of people. The question then goes back to where land distribution then goes with access to title deeds, so that it should be able to enable people to borrow money against that. And again, it speaks to the fact that social policies need to be invested not in the past, but looking forward. So how does food generation, how does the exploitation of an asset in order to raise credit so that you can start a business start? I think that the question about, that Siya Bululela asked, I thought that I'd addressed to some extent, saying that the evidence suggests that social grants are actually able to help people springboard into off dependency on the state, and actually into into economic activity. Because I have the grant, I know that next month I have some more income, I can start building. The question that we do need to know is the extent to which, through political literacy, we know that this grant comes from the state and not from a particular ruling party. And that, I think, is crucial, so that I know that I can vote for the party and not lose my grant. That's the kind of maturing of our democracy that's required. And I also thank you. Siyabulula, I just saw your thing. I have to state for everybody, I'm not a professor. I don't have any of these fancy terms. So I respectfully defer to Professor Nicholas, who has just come on board as a full professor, as I understand, and congratulations are in order from. So from my side, thank you for this opportunity. I look forward to further debates, and I look forward to the Prof having last word.
Thanks, Isobel, for giving me the last word. And let me start with the last question about a relationship between the grants and dependency. In addition, South Africa is not the only country that would be providing such social safety nets. I think during this lockdown period, the US did a similar thing, although it's not continuous, but it's once off, more broadly defined than what we have now. Secondly, I know those who depended on social grants, who didn't vote for ANC but voted for EFF. That is very clear. And thirdly, the amount of money we're talking about is just the poverty line. It's not enough to create dependency, because I don't think that any individual will just be happy receiving an amount that is at the poverty line and not do anything else. In addition to that, it is important that when we put the message out there that there should be these grants, the grants will have to be accompanied by measures that will include the previously excluded population into the mainstream production system, which it's very important. So I don't think at all that is going to create dependency. Lastly, on this point, South Africa has enough institutional mechanisms to be able to make sure that this is paid in a way that doesn't create dependency. There are various Chapter 9 organizations and this constitution that is thriving, even though the government might be having a lot of ineffectiveness. Talking about the vaccine, vaccinating the population as a means of easing the lockdown, I am not an epidemiologist, but what I have learned from what others have said, those who are more knowledgeable than me in this field, is that the vaccine does not so much protect against the spread of the disease, contracting the disease, but it protects more against severe effects of the disease and mortality, which then means that when you're vaccinated, you must still get the disease and you must still spread the disease, but you will have less chance of dying of the disease. And therefore, vaccines indeed could be a means by which we get out of the disease. But when we look at countries that are vaccinated, Israel, for example, is calling for booster shots, and they have returned to wearing of masks and other measures. We would not say that vaccines are 100% panacea from my own personal point of view, based on what I know out there. But the epidemiologists would be better placed to say that. Now, the correlation between land ownership, poverty, and inequality, it goes without saying, but it depends primarily on what you do with the land. For example, land redistribution in Zimbabwe, that is a very recent example. It led to more poverty, but it is because the redistribution did not take into account the fact that those who were formerly tilling their land had vast network of vast market networks. They were exporting the produce to Europe and others. And when people got the land, they didn't have the ability to till the land. There are a lot of issues with land redistribution in South Africa. And Isobel has touched on one point, the title deeds. If you have land that you cannot claim ownership of that land, you can't do anything with the land. Economic theory says that landed property can actually mitigate inequality, because those who have landed property are more favorable in the labor market, but it depends on what the landed property does. So if you have land and the land is productive, in times of downturn, economic downturn like now, you are willing to accept lower levels of salary because you can supplement with your land until the economy picks up again. So land becomes like a cushion. In addition to the fact that it is an integral asset to the economy, it can serve as collateral for loans for other productive activities and so on. So indeed, it correlates. I want to conclude by saying that I'm very grateful that this initiative is out. And I would say that we need more collaboration between academia, research institutes like Isobel, and the media. That collaboration should not come once in a while. It should be ongoing. And I like the question she asked, how can we help you to put things out there? When I do things, my publications are very technical, but it will help me to start to know how do I put the output of my publication in a way that media can digest. And that is when, because the policymakers don't read technical documents that we publish in journals. What they listen to is what is said in the media and the simple things that are out there. And the media is a very strong partner for us. And I thank you for this initiative, and I'm wishing that it should continue.
No, that was very lovely. I want to say on behalf of Media Monitoring Africa, Journalists for Human Rights, as well as Sound Africa, thank you very much to both you, Prof. and Isobel. It was indeed a fruitful and highly informative session, and also many congratulations to Prof on his full professorship, if I heard Isobel correctly. Personally, I have a long list of questions that I'd love to engage you guys on, but I'll take up the offer, your offer, Isobel, of having another session on this. We are greatly over time. I would have loved to ask Siyabulela Mandela to come in and close for us, but if he promises to just be under 1 minute. Thank you.
You can close, Leader. Thank you.
All right, thanks, Matiba. No, then there's nothing further to be said. Thank you guys, and enjoy the rest of your Friday and the weekend. Thank you.
Thank you so much.
The slides will be shared with the journalists, and hopefully can assist them with their reporting. Thank you, guys.
Perfect.